just being pregnant and all of the emotions that comes with that. And then after the fact, the postpartum side of things. I didn't even know postpartum depression was a thing. I dealt with a lot of providers that did not listen, that did not explain. And if they would have just listened to me and explained what was happening, maybe I would have had a different outcome. Found out I was pregnant. I thought it was going perfectly fine. I go to the doctor, he does the ultrasound, and he says to me, "We want to send you to St. Louis." And I said, "Is there something wrong?" And the answer that I got was, "No, I just want him to look at something on the ultrasound." So I go to St. Louis and I see this doctor, and I don't think anything's wrong because I'm told nothing's wrong. He turns the monitor off and he says to me, "We need to do amniocentesis because when you come back in 4 weeks, your baby will be dead." There was no explanation. There was nothing. But it's the fact of I'm asking questions and no one can give me an answer. My son ended up being born October 29th on a Wednesday, emergency C-section. He did live for 58 minutes, and that's all I asked. I just wanted to see him born alive. I didn't want him to be born and not see my face. Every time they came in the room and asked if I was in pain, my answer was yes. Because you're not asking me what type of pain. Like, my heart is broken. Yes, I'm in pain. I'm gonna be in pain every single time you come in this room and ask me, do I need medication? Because I just wanna sleep. So I think for a little bit, I was definitely depressed. I was still frustrated because I always go back to, like, what if? Thinking back, it was a little scary because I don't really know how I made it out. It was just day by day. And I honestly think if it hadn't have been for having my daughter, I don't know where I would be, because that gave me something to occupy my mind. I would encourage all providers helping patients with mental health conditions to listen to their patients. Listening is the number one thing. If your patient tells you that they're feeling a certain type of way, let them be open and honest with you so that you can get them the help that they need. I think there are really good doctors out there and good providers out there. They work really hard at trying to be the best provider that they can be. And sometimes they are overwhelmed, but I think they should still listen and not rush the appointment. My hope for the future with providers and patients in Missouri is that all providers and all patients have that good patient-provider relationship to where walking into your provider's office, you feel comfortable. You feel comfortable picking up the phone and just asking questions. Even when you think it may be a dumb question, no question is a dumb question. I just want providers and patients to be able to come together to get the best care possible for them. Some things providers can do is to create a list of local therapists, support groups that serve moms and families. They can contact the Missouri Maternal Health Access Project that connects providers and their patients to mental health professionals. And they can also engage in trauma-informed practices and grief training for medical staff. It took me some time to find a provider that I could trust. She made me feel comfortable. We talked about the loss of my child. We talked about my past history, my past pregnancies, and she made me feel less worried, less anxious. Her staff that worked with her made me feel comfortable as well. Made me feel comfortable enough to call on days where I wasn't sure. As providers, you don't have to have all of the answers. There are resources out there. We just want you to listen.